Hello, and thank you for taking the time out of your busy day to come listen to this informative speech on poison and overdose emergencies. My name is Tony Barczyk. Please save your questions and comments until after the speech, and I'll be more than happy to answer any questions, concerns, gripes, complaints that you do have about the information provided today. To begin, I just wanted everybody to know that although poisons are all around us, it's everybody's responsibility, and those as first responders, EMTs, to not only help patients in need, but also educate those who don't know. Because everybody is capable of saving a life as long as they know how to do it and put in the right position to do it. To begin, we're going to be talking about the 4 routes of poison, the way they enter your body. Inhalation, injection, absorption, and ingestion. Inhalation is going to begin with your sprays, your cleaning fluids. Your injection, obviously, is going to be about drugs. Absorption is your household cleaners, your insecticides. Ingestion will be rat poison, drain cleaners. Any household is going to have bleach, detergents, any types of soaps. So anything that's obviously going to be taken in orally. Slide. All right, we're going to talk about general patient assessment here. Every time you come on scene, you're going to see a patient. Before you can do anything to that patient, what you're going to want to do is assess what you're dealing with so you know how to treat it. And it's going to begin with what substance was involved. You want to find out what name it was. Bring a container if possible so you can take it back to the hospital or document what it was. When did the exposure occur? How long have they been contaminated, or how long has the substance entered their body? Slide. You want to find out what type of breathing they have, if it's rapid or if it's slow. You want to find out how much of the substance was ingested. A lot, a little, just a teaspoon, a gallon. You need to know these things. Slide. Patient assessment on poison overdose. Just a little bit more. It's just going to be how long ago did the exposure occur? How long did the poison enter their body? Slide. You want to find out what interventions prior to you coming there have been taken. You want to find out what the patient's estimated weight is, and what effects is it having on the patient, their altered mental status, they're having trouble breathing, those types of things. Slide. Any abdominal pain, this is just going over what I just said, any unusual breathing or any usual breath odor. Slide. All right, the first route we're going to be talking about is ingested poisons that's obviously taken in orally. We're going to talk about the history of, you're going to find out the history of ingestion, any nausea, vomiting, or diarrhea. These are all clues to help you distinguish what poison has entered the body during this assessment. Slide. Talking about patient care, what you want to do is gather information, and one thing that you can noticeably do right away is remove any pills from the patient's mouth. Slide. You want to consult with medical direction, calling a hospital or a doctor that is familiar with this type of emergency to give you a better heads up on how to treat it. Slide. Administer activated charcoal as directed. Now, activated charcoal is going to be discussed a little bit further on, so bear with me. Slide. You want to position the patient in position for vomiting. Save all the vomitus and have suction equipment ready. Slide. Activated charcoal is going to cause the patient to throw up and get whatever's inside of them out. And this is the typical forms that's going to come in. It has different types of names to get people more familiar with them and have more common ground on what the terminology is in this type of agent used to extract ingested poisons. Slide. Activated charcoal, its indication is poison by mouth. That's when you know you want to use it. Slide. Contraindications are when you don't want to use it. And that's when the patient has an altered mental status, ingestion of an acid or an alkali, and the patient is unable to swallow. Obviously, you don't want them to try to swallow something that they can't swallow. Slide. Medical forms. Slide. You can go ahead and skip that one. The dosage for adults and children, 1 gram is 1 gram for adults and children. You know, adults are 25 to 50 grams. Pediatric patients are 12.5 to 25 grams. Slide. Administration, you want to talk to medical direction. You want to shake the container thoroughly and have the patient drink a mixture. And usually this is already mixed for you. All you have to do is pour it into a cup and then have them drink it. Slide. If the patient does not drink all the medication right away, shake again, prevent settling. Record medication name, dose, route. You want to record everything because as the care provider, you are held accountable for everything you do and you don't do. Slide. Actions. This is what activated charcoal does. It binds to certain poisons, prevents absorption by the body, and some brands absorb more than others. Slide. Some side effects are black stools, you know what that is. Some patients will vomit, which is what they're supposed to do. Slide. Reassessment strategies, be prepared for the patient to vomit or for the patient's condition to deteriorate. Slide. Inhaled poisons. Some patient assessment things you want to look at for an inhaled poison would be the history of inhalation, any difficulty breathing, chest pain, cough, hoarseness, These are just common things that anybody's going to have when they're having an attack of inhaled poison. Slide. Dizziness, headaches, confusion, seizures, altered mental status. Slide. Patient care for this is going to be as follows. You want to remove the patient from the hazardous area. So if you have an enclosed garage and there's a lot of carbon monoxide, which is the most common inhaled poison, just get them out of there. You don't want to provide medical care in the scene where all the poison is still lingering around. Slide. Establish an open airway. This way it helps the patient breathe a little better, and then if you're going to administer any form of CPR or any breathing tools, it's going to be the proper placement of the patient's head and neck. Slide. Maintain an airway and administer oxygen. Now, any civilians aren't going to have the tools to do this, but as first responders, we may or may not. So just understanding the proper care you need to use for a patient experiencing this type of emergency will help you out. Slide. Remove any contaminated clothing. Slide. Consult medical direction. Slide. And then obviously you just want to transport the patient, bring them to the hospital, and the doctor will take over. Slide. Carbon monoxide is obviously your most common. It's colorless, odorless, tasteless gas, results from incomplete combustion. Slide. Causes hypoxia by taking the place of oxygen in red blood cells. Obviously, your body's not getting enough oxygen, your heart, your lungs, it's just not, so your body's not going to be functioning properly. Slide. Signs and symptoms, headaches, dizziness, nausea, difficulty breathing, cyanosis, altered mental status. Slide. Patient assessment for injected poisons are going to be as follows. Weakness, dizziness, chills, fever, nausea, and vomiting. Injected poisons, like we talked about, they are drugs. They're going to be the most uncommon, in some areas, the most common medical emergency for poisons you're going to be dealing with. But as military members or in certain areas of town, it may be the most uncommon. But however, you need to learn proper patient assessment responsibilities and patient care responsibilities. Slide. Patient care is to secure an airway and administer oxygen, be alert for vomiting, and transport the patient. For injected poisons, there's really not a lot that anybody can do on scene besides establish an open airway, give oxygen, and then get them to somewhere where they actually can provide patient care. Slide. For absorbed poisons, signs and symptoms include history of exposure, liquid or powder on skin, burns, itching, irritation, and redness. Slide. Patient care for this is as follows. Slide. You want to remove the patient from the source without contaminating yourself. Slide. And you want to brush off any powders that are on the patient. Slide. Remove any contaminated clothing and any other articles on the patient. Slide. Irrigate with clear water for at least 20 minutes. Slide. Patient care for anybody and any patient who has a poison contracting the eyeball. Irrigation, irrigate with clean water for at least 20 minutes and continue en route if possible. Slide. And relationships to the airway for poisonous emergencies. When treating a poison or overdose patient whose airway is patent, be prepared for deterioration and need to secure an airway. In almost all these patients, you want to maintain an open airway and secure patient with proper air supply. It's going to give you a much higher chance for survival. So today I educated you on the 4 different routes of poison that may enter your body. It's important to understand, like I said before, both patient care and assessment. And for those first responders that will be treating a patient, it's not only their responsibility to understand and know the material and the procedures, but educate those who don't. Once again, thank you very much for your time. My name is Tony Barczyk. If you have any questions or comments, please feel free to ask them now.